Visceral manipulation, it's called, or abdominal massage. Really, I see it as two ways. First is just putting hands on the abdomen, where, remember we talked about this vulnerable area? Vulnerable, sensitive. What other associated word we use for the abdomen? Sensitive. Sorry? Sensation of burning. So if you put your hands on an area that we mentally associate as sensitive or weak or burning, in a way we're treating that association. So it's a nice way to think about it. If somebody's having, think about shoulder, not only as a shoulder, but as a way of, giving, putting your hands forward. So imagine someone who is having difficulty in this process of taking or giving. So the association of our treatment is not only the physicality of it, but actually the mental association we have to everything. The back, when you're talking about the back is support, strength. So someone who's feeling backache, it's not only the backache, but the association they have for having pain in the associated strength area. So you're treating the symbol, the association also. Yeah? So we could take it to kind of just working psychologically, mentally onto that area, but just having a very light touch, and we'll do that. But also, same thing, improving the blood circulation, relaxing the person, and working on the frame of the musculoskeletal area. So here it is. The way I see it is that the digestive system has a frame around it. And the frame is more the muscular and the bones frames. The frame is the ribs, the lower ribs, spine, and the hip. So sometimes, if there is any structure underneath the ribs, I can't go in there, I can move the frame. I can move the ribs, and you see that I use a lot of ribs mobilization to work into that area. Or I can use the hip, and use the hip. If the small intestine here, I can't go in. What I can do is move it a little bit. And by then, every time you move, you change a little bit, you're squeezing the blood, you're relaxing, squeezing, the same thing as muscles, yeah? Also, let's look at the structure. Where are they? Well, the esophagus is behind that, it's kind of protected, so maybe you can do some of more spine movement. But when it comes to stomach, a lot of it is actually sort of like work on the ribs themselves, and with it you move the stomach. You can't hold the stomach like you're holding the biceps and start moving it. So it's more of almost like imaginary work sometimes, that you hope that you're in the right place. Then after the stomach, the small intestine, that is just a mesh here. There is no way you could identify a specific area. But what you're looking really is like everything, an area that you palpate that is in tension, and you can just move it very, very little. And even hold it. And then move it again very little, maybe a bit of a circle, and then let go. Now, sensitivity-wise, you have to be a lot more sensitive. You can't go in and out very quickly, because remember, the association of this area, sensitivity, soft, it's the stomach of the body, yeah? The soft, how do we say soft stomach of the body? Yeah. There is the soft stomach of everything, right? Which is the more delicate area in common English. So then after that, the large intestine. Now, large intestine goes from here, from the right side, upward, across, downward, and then into the hip and right into the sacrum, just in front of the sacrum. Now, the problem is that a lot of the therapy is saying, okay, I'm traveling this way, that way, and that's what they're trying to do is they're saying, okay, I'm going in the direction of the flow, and with it, I help with evacuation. Yeah? Now, how much is it really helping? I don't know. It's kind of theoretical. But what I want you to think of is that even if you're saying that the large intestine goes in this direction, you have to look at it in 3 dimensions, because a lot of it is not here, but it's actually kind of backward. And you have a lot of other structures in front of it. So sometimes it's kind of a bit of superficial to say, okay, I come only from the front of the stomach. That's why I like a lot of the side approach. You're approaching the side structure, you go into a deeper level. So don't think only forward, but how you can approach in here. If you have a structure that is here, like that, if you come from the front, if the skin is here, it's kind of hard. If you come from the side, it's a lot easier, because it's a lot more accessible to it. Okay, so kind of a lot of things to consider, but let's start then. Where is, yeah, good. Let's stop for a second.